Microraptor knotless anchor is a unique anchor from Smith& Nephew for a knotless repair of the Bankart lesion. The surgery starts with preparation of the labrum, which we usually do with the radiofrequency device. And what we do is we need to prepare the labrum, we need to release the labrum well off the glenoid surface, and we usually use a wand to release the labrum from the glenoid surface. Once the labrum is released, then we use the AccuPass direct suture passer to pass the sutures through the labral tissues. And this we do with using special instruments. Now, in this particular case, we are demonstrating a tape, but you can use either a suture or you can use a tape or you can use a lasso loop configuration or a looping suture, and you pass it underneath the labrum and take a loop which will be used for the knotless repair. Once this loop is passed, we start our preparation for insertion of the Microraptor anchor. The Microraptor anchor is inserted dead into the glenoid face. The drill is 18 millimeters. We make a pilot hole and then we load the mouth or the tip of the Microraptor anchor with the tapes or the sutures. It is made up of two implants. One, this is a distal implant, and the other is the proximal implant. And we need to screw in the proximal implant into the distal implant so that it fins out and lock into the surface. As I told you, the threads are packed into the tip of the anchor. The anchor is tapped into its position, and once it is tapped, there is a knob, gray colored knob, which is rotated and which locks the distal anchor into the proximal anchor, thereby opening the fins. And this lead to a very secure fixation of the Microraptor anchor. And this is one of the best knotless anchors to work with. So you can use multiple passages and can have a very nice fixation. Now this is a Regensoft material, so it is absorbed and converted into the bone in 2 years of time, and it is integrated nicely into the bone of the glenoid.